think yourself, oh, I gotta do that, I gotta do that. That will help you learn. In fact, I promise you that by the end of the 5th scenario, you guys will be like, oh, it needs to be faster, or we forgot to call 911, or this, that, and the other. Okay? So don't worry about making mistakes. Just keep right on trucking, and I'll give you these scenarios in real time. We're gonna try and do 5 scenarios today if we have time. And I'm just gonna tell you, oh, patient's pretty blue. That means they're what? That we need to fill in any code. If somebody dies, there needs to be someone in. I am in charge here. Who is that usually? One of them, right? Okay. The second role that needs to be established, and usually this is established by a leader, is what? Who's doing what? What does the leader, the very first thing a leader would call out? No breathing, no pulse. You call 911.
Yeah, but they can wait there. They're already familiar. They can talk. They can give directions. Guess what they do all the time to people that can't find your place? Give directions, okay? That's what you're doing. Only 911. What role? What did you say? Where is the AED? Don't ask me. You don't work in this facility. You need to close your eyes and imagine yourself in Corsicana or Paris. Can you walk right to it, pick it up? Very good.
Oxygen.
Okay, he'll ask somebody to go get the oxygen. Usually that would be the same person. So are you ready to fill that role?
Wouldn't we start compressions before trying to get the AED?
To have it in an order, you would actually call for the AED the minute there's no pulse. But I mean, you're talking about seconds here, like 2 seconds. Get the AED, you chest compressions. That's what it would look like. You have assigned roles. You can't really do that. Why can't you do that? So that when you go to a code where someone's not doing well, you are ready for 1, 2, 3, 4, 5 different roles. Why? Why is it that the leader should not be doing all those things?
Because he can focus on
Right, so he is focusing on what he's doing. He's got to check all the boxes. That's his job. If he's doing chest compressions, he's not remembering to do all that. Very last thing that usually gets filled.
Doesn't that person go outside to make sure the ambulance is on the way?
No, that's usually the 911 person that should be out there, hopefully, guiding them in. What's
record?
They keep a record. That's right. If you have enough people, the last person that...
What the scenario was.
Okay, you need a summary for medical legal reasons.
Okay, so like that.
Like 30 seconds ago. Right? So the person writing down is writing down what you're doing. The person writing down says...
Poor Shell. I'll never forget that. That's poor Shell. You may. Do you mind if I put you on YouTube?
I don't know.
I just saw a release.
I'll let you look at it first.
Okay.
This is our chance to be superstars.
Because I have followers. 21.
All right.
21 subscribers, girl. People like me.
In this scenario, you have a small child. The child's been undergoing dental treatment with oral sedation. Do you do oral sedation in your office? For about 20 minutes. And child 7 years old starts to cough. Cough, 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 cough. Keeps coughing. And then he stops coughing. Alright? And all he was having was a cleaning. This isn't like major surgery doing a treatment. Either of you a hygienist? Well, you are today. Alright, so go ahead.
Pulse.
He's not breathing. There is a pulse.
Okay. So we're going to lean the head up, chin up. Is breathing not a pulse?
That's right. And he's actually on the pulse oximeter because he was orally sedated. So the pulse oximeter says 75 for his O2 sats.
Okay. So if he doesn't have a pulse, I'm going to start chest compressions, correct?
Should I be recording?
I don't know. Can you help us? I haven't done this since I did the CPR course, like when I was in school.
I'm about to help you. I'm letting you struggle for a moment.
And that's probably younger. I'm feeling that.
Poor child.
The child is about the color of her blue jeans right now.
Keep his head here. I'll hold his chin. Okay, okay.
911 says, we're on our way. What happened?